Hello, and welcome back to another episode of Straight Up with Steph. I'm so excited to share this episode with you today because it's super relevant as far as what's going on in dentistry right now. I've done numerous podcasts about the situation that there's a hygiene shortage. People need to find hygienists. And so other people potentially are going to be trained either with some official training or on the job to become quote unquote hygienists. Our national association and our state associations are working really hard to, fight these things as they pop up. But a new organization is on the map now called the Oral Health Awareness Project. And their main goal is to create a PR campaign to educate the public on what hygienists do. There's just a running joke, and it's kind of a lame joke, that hygienists are just tooth scrapers, right? We've all been called that either by patients or even people within dentistry, and that needs to change. I've been a hygienist for over 17 years, and that misconception about hygienists has been there the whole time. And honestly, I'm sick of it. It needs to stop, and people really need to understand what we do. Today, I decided to bring on Lisa. She's a hygienist. She's been in dentistry for a long time. And I actually heard her on the very first webinar of the Oral Health Awareness Project. And I just wanted to bring her on and pick her brain. Today, we talked about what the Oral Health Awareness Project is, what their goals are as far as educating the public, and what they need from us as hygienists. We also talked about some other initiatives that have been proven successful. I think people have questions about that. They're just like, well, if I give my money to this, is it actually going to work? But there have been several campaigns that have been really effective. I asked her about transparency, like, are we going to be able to see where our money is actually going? Because that's a concern that I've had over the years when I give my money to various associations, and I see comments like that online as well. But her goal really is to just share everything top to bottom, black and white, as far as how much money they're getting, where it's going. This organization is made up 100% of volunteers. They're not getting paid at all. So all of the money that they're collecting is going to this big PR campaign. We also talked about how hygienists, there's blame to go around on all sides, right? Like, it's not the fault of dentists or dental assistants or hygienists or DSOs or whatever. It's not like one group is to blame for the situation that we're in. We all have played our part. And we talked about hygienists and what we have done wrong over time and how we can start to be better at advocating for ourselves and elevating our care and our profession, whether that be making sure we're practicing at the highest level that we can or educating our coworkers or patients on what hygienists actually do. So today was a really fun conversation. It's a new spin on a solution that I think that we have needed for a long time. And she was just a great person to talk to. So I hope you enjoyed today's conversation with Lisa. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Lisa. Thank you so much for joining today. It's good to see you.
You too. Thanks for having me, Stephanie. I appreciate it.
Yeah, I've been wanting to just have you on and pick your brain ever since I took your webinar. I think it was your first webinar with the Oral Health Awareness Project. So I know we're going to talk all about that. But before we get into that, what led you to create the Oral Health Awareness Project? And then what is it?
Sure. So for the last 5 years, I've really felt that a PR movement for the dental hygiene profession has been necessary. And as a hygienist, Stephanie, I think you can agree that we don't have a lot of respect just yet. I think the public still views us as teeth cleaners. They call in and they want to schedule their cleaning appointment. And I don't believe that they really have a good grasp on what we provide and the care that we provide. And I think that's why it's so easy for legislators to pass laws that allow individuals to be trained on the job to do cleanings because they don't understand the extent of what we do. So because of that, I started thinking of what was happening. And we know that we're in a state of emergency right now with everything that's happening in our profession. And I started to think to myself, how can we combat this? And I really did feel that one of the ways that we can combat it, we might not be able to fight organizations that are big, that are coming up against us, but we could go to the public. We could go to our legislators. We could educate them on what they should expect when they come in to see a CODA accredited degree holding RDH. And then they will start asking the questions and they will start demanding comprehensive care. That's where this began. I think it's an amazing movement. I think that we've never done it and we should. So that's important to us.
So your goal with the Oral Health Awareness Project, by the way, do you have a shorter name, like a nickname for that, like OHAP or something?
OHAP. Everybody calls it OHAP and I love it. I think it's great. So
okay. Yeah. It's just like, okay. It's just a mouthful.
Because it is long.
Yeah. No, it's cute. I like it. So your goal is to raise funds to create basically a PR campaign so what does that look like? Like commercials or social media ads or what?
Yeah, so we're actually hiring a PR firm that we researched, and I really fell in love with them for two reasons. They have dental knowledge. So they actually worked with, I don't know if you know Misty Mattingly from Georgia, but
name's familiar. Yeah.
Yeah. She's an amazing dental hygienist. Then she heads a DSO organization by the name of Sage. So Matter actually provided PR for them for 3 years. So when I was in the meeting with them and they mentioned they worked with Sage, I was like, wait, do you know Misty? And they're like, we love Misty.
Oh, that's cool.
So right away, we got into the dental hygiene conversation and I got that they understood us because of the fact that they worked with a dental hygiene leader. So I loved that. And then when they mentioned Pearl to me, I thought, okay, this is it. So everybody knows Pearl, right? The AI for radiography. And so many offices have implemented it. Well, Matter has been at the forefront of their PR, of their marketing. And we know that they have grown incredibly and probably most practices have integrated them. So that was really big for me. I felt like, okay, this is a company that's going to understand us, that understands dental hygiene, and that's great. So when I asked them and I told them I was having the kickoff meeting, which you were on, they sent me a huge presentation on everything that they were going to do for us, from branding to creating taglines, content development. They're going to do tons of press releases for us. And another thing that I love is that they're going to go ahead and jump in when there's a crisis. So they're going to be watching out for legislation around the country. And when they see that states start to try to like introduce an ADHP or an OPA, whatever it may be, they're going to know that that's a state they really need to target when it comes to the media, when it comes to journalists. So they're really gung-ho. And I love that they're looking into us already, even though we haven't signed the contract. They saw the article that Bethany and I published and they're like, wow, that was a great article, and sent a message to me. They're also going to put us into publications that are not just dental related. So they're going to get us into like the New York Times, Axios, Business Insider, CNN, MSNBC. They're going to get us into healthcare publications. I wrote a couple of them down, like Healthcare Business Today, Chief Healthcare Executives, because they get to interprofessional relationships are really important too. So it's not just within dentistry. They are getting us out everywhere, and it's nationwide.
That makes sense to me because it's like we can publish articles all we want in our dental publication. I mean, people, the general public is not reading those.
Correct.
So
Correct.
It'd be kind of weird if they were. But going back to what you mentioned earlier, as far as this perception that hygienists are just teeth cleaners. I mean, I've been a hygienist for over 17 years, and it's like I've just heard that all the time, and even now. And it's not just the public, it's people within dentistry as well. And when all of this started with even back last fall, when the ADA brought up maybe training dental students or internationally trained dentists, and then we have dental assistants with the OPA, I'm just like, okay, they still don't know what we do if they think that this can be trained on the job. So why do you think that misconception is still there?
There's a couple of things, and maybe I won't be popular for part of my answer, but I'm still going to share it. But,
okay,
I absolutely feel that, first of all, dental hygienists still use the term tooth cleaning with patients. So the first thing is we got to remove that from our vocabulary, right? Like if we're calling what we do a cleaning, then how is the patient ever going to understand that we're healthcare providers performing risk assessments that actually can save lives? That's the other thing that I've encountered on the OHAP Facebook page is when I say we save lives, I have hygienists fighting me saying, you can't say we save lives. And I'm like, well, what do we do? Because, when we talk about the risk of heart attack being 50% for individuals who have periodontal disease, and we minimize the inflammation and we reverse the disease in the mouth, aren't we leading to better health outcomes?
So with like oral cancer screenings, I mean, if they think saving lives means giving CPR to every patient every day, then no, that's not what we're doing. But we're just looking like we are promoting health.
We are. And I think I shared that story about the one patient in our meeting that came into us and had radiolucencies on her lower jaw. And we took a CBCT scan, and she was in the hospital for a 12-hour surgery. They had to remove her entire jaw, lower jaw, up until tooth number 22, put a synthetic jaw in. She was in the hospital for 7 days recovering from the surgery. And this all happened because she came in to see her dental hygienist. And thankfully, it wasn't cancerous, but it still led to treatment that was very expensive. And when she came in and she was still swollen from the surgery, if that doesn't tug at your heart,
yeah,
and doesn't make you realize that we don't just polish teeth, that's a problem. And, the other thing is that I think, and we can't hide the fact that, yes, for many, many years, dental hygienists haven't been appreciated. For many, many years, maybe they have been underpaid and they haven't gotten benefits. And it has disheartened a lot of dental hygienists. And maybe they come in and now they just treat this as a job and not as a career.
Yeah.
So maybe they are just scaling, polishing, and dismissing, scaling, polishing, and dismissing. And that's what patients are getting. So that's the perception that even our legislators who are our patients see. How hard can it be to teach? Scale, polish, dismiss, scale, polish, dismiss. So I think that's where I'm unpopular, because I think that a lot of us have leveled down the care that we provide. And because that, it seems like it could be easy to teach just anybody to do what we do. So we really have to elevate our care. We have to elevate our treatment so that we're respected and so that the public knows that, hey, this is important.
Yeah. And I know myself, I've been guilty of calling it cleanings. And it's like, I know I shouldn't, but it's like I'm dumbing it down for the patient because I don't want to say something they don't understand. And then I have to explain it or whatever, but maybe I'm looking at it wrong. Maybe I do need to take a minute or two, call it what it is. And if they have questions, start explaining what I'm actually doing.
Yeah. And we've even trained our entire team, because that's important too, right? Sometimes offices don't train their admin team members to understand what we do. So when the patient says, oh, I want to schedule my appointment with the cleaning, let's change that. So my admin team knows to say, okay, you mean your preventive care appointment with Lauren? So we're trying to change their verbiage too of why they're coming in. And then they're like, oh yeah, that. And then we can even explain why we call it that if they ask the question. So I think even educating our patients on that is important. So just the whole team has to be on board.
Yeah, I agree. And I think probably hygienists, I'm sure that they all know better, like I know better. But if you go to an office and they're calling it cleanings and the patient's calling it cleanings and front desk and the dentist and everyone, you're just like, oh my God, all right, I'm just going to call it a cleaning.
I know. Sometimes you just give in and it's like, how often do we have to say no cleaning, no cleaning?
Yeah, right. And it's the same with the word deep cleaning. I'm sure you hate that one too, right?
No, yeah, we do non-surgical therapies. We call it a therapy to patients so they understand. And that's the other thing too, is in creating this PR movement, and you had mentioned we're just needing 2% of dental hygienists to jump in on this, right? That's all we need. And I don't want to tell everyone, oh, only 4,000 of you do, because then I'm afraid everybody will be like, oh, somebody else will do it.
Exactly.
Like if we all sit back and don't do it. But we have 220,000 dental hygienists in our country. That's licensed hygienists. There's a lot of hygienists. So to ask 4,000 of them to be a part of a movement that's going to create incredible change in our profession, because I truly do believe that's a small ask. So it's been slow. And I think some of the members of the task force had been a little disheartened. Like they thought overnight we'd get it. You know what I mean? But I do understand that people need to sit back, because there's been so much and they have to gain trust and they have to truly believe that the initiative is going to be effective. So I get it. You don't just throw money out there. You have to make sure that it's going to be used properly. So,
yeah. And this, I mean, I can totally sympathize with you have this amazing idea, right? And you just are so pumped about it and you think everyone else is going to be pumped about it. And like you said, you thought overnight you would get
We'll have it.
these signups or whatever. And I was the same when I started my business with ergonomics. I was like, oh my God, this is an amazing idea. Like, I can't wait. And then crickets, like it just takes a lot longer than you would think. So since you mentioned 2% of the hygienists, so like how many hygienists are you looking for? And are you looking for $20, $100? Like how much? What do you need?
So we did make the minimum contribution $100, which is a little less than, a lot of everything that you would have to pay for. And we feel that everybody keeps saying, bring it down to $20. But here's the problem. And this is not that we're saying it's not going to work. But let's say that we don't get to our number. We want to be transparent about this. We don't get to our number. I need to refund every single hygienist that donated. And if I'm getting $20 donations, Stephanie, how many refunds do I have to
can't.
Right?
I can't.
So while I would love to bring it down, I also feel like how valuable is our profession to dental hygienists? So just like when we try to sit down and recommend salivary testing to patients or perioprotect or non-surgical therapies, and we have to help these patients understand the value of investing in these services, what do we need to do to have hygienists understand that $100 to protect your profession?
Yeah.
Like, is your profession valuable enough? And we've gotten hygienists to even post it, like it makes me a little bit emotional because they're like, what happens when our salaries go down $20? Or what happens, when all of a sudden we don't have that, we're going to stand to lose more than $100. So yes, we just want $100, a minimum of 4,000 hygienists, $100. That will get us everything that we need for a year of PR. And with that said, we'll also have a little bit of a cushion because let's say that you're in Colorado, right, Stephanie?
Yeah.
So let's say that in Colorado, all of a sudden they're trying to pass an OPA and you want to go in front of legislation and you want to testify and you want to represent for the dental hygiene profession. Well, we want to be able to say, Stephanie, we'll help with your travel costs to go do that and to spend a day in front of legislators. So we want to be able to support hygienists in different states who want to be the voice for dental hygiene because it can get expensive to do that. So we want to have a little cushion for that, but everything is going towards this PR firm and then a little cushion to helping dental hygienists to advocate for us because we're going to need that.
Yeah. So something honestly, I felt this over the years and I see comments, online that when people have supported organizations or giving money or whatever, they sometimes get frustrated because of the lack of transparency and they don't know if their money is going to pay someone's cushy salary or if it's actually going to what they think it is. So how, are you able to provide that as far as showing people where their money is actually going? And also, is it tax deductible? I was curious about that too.
Yeah, absolutely. And I knew that question was coming up. So I'm ready for it. So we have, I don't know if everyone knows Danella Miller. She was actually treasurer for ADHA for quite a long time. So she's actually stepped into the treasurer role with this because she understands the financial aspect of any type of organization. So absolutely, all the money coming in pretty much is going right out to the PR firm. Our goal is once we get what we need to pay for this, we stop collections.
Okay.
So we don't need anything else. We want to get what we need for the 1 year, and then we're going to say, okay, we don't need anything else. However, if we feel as members that the PR firm is gaining leverage and we want them for another year, then at 6 months of them doing whatever they're doing, we'll come back and say, okay, if we want them for another year, we need another donation to pay for them for a year. So it'll be super easy for us to be transparent because we're not going to have millions of dollars coming in.
Yeah.
We're going to have just the money for the PR firm. Nobody on this initiative is getting paid. Not one person gets money from this. All of the money is for the initiative. So we are all volunteers volunteering our time for this. And the funny thing is that a lot of the individuals on our task force aren't even practicing hygiene. Because of disabilities. I had 2 shoulder surgeries. I mean, I can't, with you teaching ergonomics, you know where that comes from, right? So But unfortunately, one of our members had a brain tumor, which left her blind in one eye, and she can't practice anymore, although she loves dental hygiene. And here they are still advocating to save our profession for those that are still practicing. Yet none of us are getting paid. It's volunteer. We want to do this because we want to make a difference. So yes, we will be very transparent. We have emails for everyone who's donated. So we will be able to send out emails as the money's going out for the PR, how much money's left, so that we know exactly what's there. So very transparent.
I really like
he's
that.
Getting rich, I promise.
Oh, no, I appreciate you saying that. And honestly, I really admire everyone for volunteering their time. I know how valuable time is. And it's like, I don't even know how I feel about you guys not getting paid, to be honest. I think it's noble and I think it's great, but also I know the time that it takes to pour into something like this. So anyways, I thank you for saying that, but I'm just not sure how I feel about that.
Well, you know what it is, though? I think it would be different if we were taken on having to create the social media posts, if we were taken on having to create all of the material, but we're not. We're handing it off, right?
Yeah, that's true.
Yeah, the hardest thing has been getting it together, like getting the emails for the directors of the schools so we can send them an email and get faculty on board. That's been the hardest work. But once all of that is done, Matter's taking it over. Okay. And then all we're doing is saying, hey, we need help in this state. We need help in that state. Can you reach out to this group? So we won't have to do the work. And I wanted it to be that way because too many times we volunteer and put too much time in and then our families suffer. Right.
Right. Yeah. I don't know how you do it all, but that makes sense. And I just want to say too, the little bit I've learned about social media over the years, like it's just constant, like whether you think people are listening or not, you just keep posting and keep grinding. And then you end up getting momentum, and you guys have done great with I see your posts every day. I just saw one this morning. It was just like a meter on what the money that you guys have gotten and how much you still need. And that's the kind of thing that I resonate with. I'm like, okay, got it. Like it's right there for me to look at.
Yeah. And we're listening. I get emails and private messages and phone calls. That's the hardest thing. And I don't mind because I can't turn anyone away. So if someone says, can I call you right away? And I've never met them, I'm like, sure, we'll call, we'll talk, because everybody's excited, right, about this. But that was suggestions that members had. Can you have the meter? Can you put it on the website, which now it's on the website, so that we can see where we stand? They want to know where we are. So, and I've even had hygienists who come to me and it breaks my heart because they're like, I'll donate again. And I'm like, but you shouldn't have to. You donate it once. You shouldn't have to donate again and again and again because 4,000 hygienists can't do this. I don't think it's fair for the same people to always be the ones taking on the brunt of the work and labor and money. 4,000 hygienists, I think we can do this. I do. I feel really confident.
And how many members do you have in your group now, by the way?
There's probably about 350 who have contributed to make this, which is huge. But a lot of people, Stephanie, believe it or not, they're not just giving $100. I have a good majority who are giving $300. I had one who gave $5. I had another one who's not in hygiene who gave $1,000. So everybody's giving what they feel they're able to give in order to help and to make up for maybe hygienists who can't afford it. Because I know that there are people struggling right now with the economy. So I have to be empathetic to that, and they get upset. They're like, oh, and I'm like, I get it. Listen, just be a part of this group. If you can't do it financially, 4,000 hygienists can. So,
and how many do you have active in your Facebook group right now that
there's
not necessarily donated? 5,000?
There's 5,000.
Correct.
Wow. Thank you. And that's in the course of 3-4 weeks now. So we have 5,000 dental hygienists on that page, which with those hygienists alone, we could do it, right?
Right.
You have to understand that there are people in there that are just looking in to see what's happening. They really aren't. From you starting your business, that you get that, right? You get people that just want to know what you're doing or, and aren't really interested in being a part of it. But I'm okay with that. It's okay for them.
Yeah, and you never know. Like, it's such a long game with this, and
It
people could
is.
just be sitting watching for months, and then all of a sudden they decide to give you a few $100. Like, you never know where it's going to go. Is it tax deductible, their donation?
Oh, so that's right. So what we did was we had to do a 501(c)(4) instead of a 501(c)(3). And the reason that we did that was because with the three, we're not able to be a part of the legislative process. So if anything comes up, bills, laws, whatever it may be, you're constricted with a 501(c)(3). With a 501(c)(4), you can go in and you can fight legislation. You
Okay.
can go in and you can use PR movements. But with that, unfortunately, the contributions are not tax deductible. So
Okay.
if someone gives $100, they can't write it off at the end of the year because of the fact that we're a 501(c)(4). But I still say that $100 is pretty powerful
Oh,
to
yeah.
allow us to fight legislation and to be able to, we definitely had to make the choice of what's more important. And being part of the legislative process was probably one of the most important things.
Well, and $100 is, I mean, it is a lot of money, but it's also, you could equate it. It's like a decent pair of jeans,
Yeah.
like
Yeah.
it's doable for, I don't know, many people, I would say.
Yeah.
What do you say? Because when I go online and look, like on your posts or other posts, some people are saying that it, I don't know how to nicely say this, like that this PR campaign educating the public is not what we need to be doing. And people should be funneling their funds to maybe other organizations. So I want to hear what you have to say about that, but also are there examples of this working in maybe another profession?
Oh my gosh, I have so many examples. So yes,
Okay.
absolutely. And I do want to spend time doing that, but let me answer your first question. It's been a little and I think we're moving the pendulum in the right direction. Bethany Montoya has been amazing in making sure that everything that we put out there is not about destroying another organization or trying to put them down. We've really been trying to foster collaboration, right? Because not every association is for everybody.
Hmm.
So while we have the ADHA and we have these state alliances that are starting to surface and advocacy groups, it's not every association is for everyone. And I respect that. But I feel that hygienists should be a part of something. They don't want ADHA, be a part of something. So it's not a competition with all of these associations. This is not why this was created. It absolutely wasn't created to take money away from ADHA or membership away from ADHA. I don't know if you read some of my Facebook posts, but I actually approached them first. Because in my
ADHA.
ADHA, I was an active leader with ADHA. I was president of our state association for 3 years. I was a delegate to the House of Delegates for close to 6 years. I mean, I spent a lot of time. I know the association. And to myself, I thought, wow, this could be the biggest move they ever make.
Yeah.
If they launch a PR movement, and dental hygienists say, I see where my money is. Look at what we're doing. Look at where we are now. We're being elevated. We're being respected. I felt that it could launch membership for them. And so I did. I reached out to some of the current leadership. I sent a letter to the ADHA asking them to be a part of this because I want them to grow membership. I want them to, as a national organization, be successful. But unfortunately, the response was that they couldn't at this moment jump into an initiative like this, which is what made us move and do it on our own. So I didn't want to do it outside of national. I wanted them to have the opportunity first. When they said they couldn't do it, then I said, okay, then we can do it outside of this. So this is why I made it clear that membership isn't an ongoing yearly membership. We're not an association. We're an initiative, right? We need a one-time membership fee, and we can't call it a donation because if we were to take donations, Stephanie, we would have to submit paperwork to 50 states individually. They all have rules for it.
Isn't that crazy? Like, it shouldn't have to be that hard, but it is.
It is difficult. And then not only that, we would have to submit reports to every single state individually. We would have to, and I was like, no way. Now that I'm not taking on,
Yeah.
I'm not getting paid for. So this is why we had to establish a membership because that way we can collect. So no, this isn't against any other association. I think we should be working together in unity. I think that the ADHA is working on great things that they need to be working on as a national association. but they're not working on this, and this is different. So I feel that I would love to hear, instead of this doesn't work, I think that it can work.
Yes.
So let me share, and I might look over, because I have several, some of the PR movements that were actually started by individual people, not even big organizations or associations, and we'll resonate with some of them. So we know the civil rights movement, right? Started by Martin Luther King Jr., by Rosa Parks, by some church leaders and local activists. And they leveraged the media incredibly, right, in moving their initiative forward. They were able to get press releases out there. They were able to partner with celebrities and journalists and politicians to be able to get laws passed. And we know what they accomplished in doing it. Right. So they were able to ban discrimination. They were able to get rid of segregation in public places. And this was a people-led movement. Another one was Mothers Against Drunk Driving. Right. And we know that that was started by one person, a mom who lost her 13-year-old daughter, Candy Lightner. And she lost her daughter due to a drunk driver. Right. Taking her little girl away. And she started a movement that once again was a grassroots movement. It was a movement that used testimonials to tug at people's hearts, to tug at legislators' hearts. And we know what she did. I mean, there were states that allowed drinking under 21 at one point. You could be 18 and drink, right? And because of MAD, the legal drinking age moved to 21. Right. And there were stricter penalties and stricter laws brought in for DUI. And this was one person who started it. And it was a grass movements initiative that we all know it was effective. Another one was the tobacco control movement that was created by doctors, patients, past smokers who teamed up with American Heart Association and CDC to go ahead and restrict smoking in public places like airplanes and restaurants. And they were able to pass a law that allowed the FDA to control tobacco products. Again, a grassroots members initiative. But you said share initiatives that have to do more with us. So I have to bring the Nursing Association into this.
Yeah.
Okay. Because there was actually 3 different initiatives that they did. One was the Nursing Now campaign. And that was actually started by the World Health Organization as well as the International Council of Nursing. And the whole point of this campaign was to elevate the nursing profession, to get them to a place where they weren't. Again, using things like the media, press releases, reaching out to governments and legislators to pass laws that actually enhanced more schooling for nursing. So we keep hearing about, oh, there's a shortage of dental hygiene. And the answer is, let's just introduce these non-educated individuals who can be trained on the job. Well, how about if we maybe try to figure out how to improve dental hygiene schools? Because it's expensive, right, to start a dental hygiene school.
Yeah.
So
and it's super competitive to get in, and the class sizes seem kind of small. And
yeah.
It's a lot.
And then the other one, go ahead.
Sorry, when was that nursing campaign that you just mentioned?
I don't have the year that it was done, but I know that it was recent because they Twitter, Facebook, Instagram.
Okay.
So they use like all of these latest social media platforms to actually get their messaging across. So that one was done. The other one was done in 2001. And this was the Truth About Nursing campaign. Again, started by one nurse. Okay. Sandy, her name was Sandy Summers. And her whole thing with this was, hey, nurses aren't being respected or viewed in the media the way that they should be viewed. So they still have this handmaiden perception that they're subservient, that they're unintelligent, being overly sexualized in TV shows and commercials. And the whole point of this was, let's take them out of that status and move them into a respectful status where they were portrayed in shows like ER, which we've all seen, ER and Grey's Anatomy. All of a sudden the nursing perception changed. It was more respectful, right? So this campaign was all about elevating the nursing profession into they are critical healthcare providers, right? Autonomous, which their autonomy is a lot better than ours. We don't even have it in dental hygiene, right? So, and they did it again. Social media campaigns. This movement actually didn't do a lot with legislation. It really tugged more at the public. in order to gain the respect that they wanted.
It's interesting to me because me personally, I have so much respect for nurses and I really admire what they're doing. And it's just so surprising to me to hear you say that they felt like they weren't perceived that way because I've always looked at them that way. But like hygienists,
and it's because of these campaigns, right? Yeah, in 2001, that perception was changed. And you're absolutely right, Stephanie, because I was just in the hospital with my mom who had major surgery for 2 weeks. And I knew who was coming in to push her meds. I knew who was coming in to check her vitals. I knew who was going to be taken care of. It wasn't the doctor. The doctor showed up once in the morning. That's it, just to make his rounds, with 10 different med students. But it was the nurses that were there, and we know when we see a nurse, we have respect for them, right? Because we know what they do. So finally, the other one I wanted to talk about was a campaign that was done by Johnson & Johnson. And I thought this was interesting because it was the Campaigns for Nursing Future, and it was when there was a shortage in the nursing profession. So what Johnson & Johnson set out to do was to highlight the nursing profession in order to inspire individuals to enter it and to increase enrollments in nursing schools. And they did it. They were able to do it. And actually, this campaign went down in history as one of the most successful PR campaigns in healthcare and improving the shortage in nursing. So for me, I start thinking, who can do that for us? I mean, we have big companies that have commercials on TV like Colgate and Procter & Gamble and Philips. So how about if they highlight our profession and show the public how incredible it is and the work that we do and how we change people's lives and try to get really good people inspired to join us? Maybe that can help with the shortage that we're touting.
Have you reached out? I'm just thinking of just an example is Crest, and they have their, oh God, I'm blanking on it right now. Oh, Hygiene Proud.
Hygiene Proud.
Yeah. I mean, have you reached out to them to see?
So I did. Yeah, I did speak to Jackie because I'm going to be at RDH under one roof. Okay. And a lot of people that are instrumental in these big organizations will be there. So that's why I'm not trying to work the booth the entire time because I want to work the companies.
Yeah.
So I'm going to approach them because I think there's a fear in the companies jumping in to help because they think, oh, what will dentists think? That's
the other thing that drives me crazy, Lisa, is just because you believe in hygienists and you want to elevate them doesn't mean that you are anti-dentist. I put a post about that. I'm like, why? It doesn't have to be one or the other,
Exactly. And honestly, if they were to do something like what Johnson & Johnson did, what they're doing is helping the dentist. Yeah. Because they're helping to bring in individuals into this profession that'll help to fill spots. And again, I am very realistic with this stuff. We both know from speaking to dentists, and I go to conferences as a practice manager where I sit with dentists and I hear what's happening in our country. And we can't ignore the fact that they are having issues finding dental hygienists. They are. So as much as people are saying that it just has to do with there's not good practices out there, I don't believe that. I truly believe that there is a shortage. There isn't enough hygienists out there to fill positions, and dentists, which is a scary thought to me, are jumping in to do hygiene because they have to. They don't have a choice. So how do we fix that? Let's get a campaign going, right? That gets more hygienists in the chair, and let's work with dental hygiene schools to have a stricter. I mean, when I sat through the committee that selected students for Montgomery County Community College in Bluebell to come into the dental hygiene program, first of all, we didn't even know the names of the students, which I didn't care about that. They were a number. The way that we picked them was based on their grades. So if they had an A, they would get 8 points. If they had a B, they would get 6 points. So whoever had the highest points, these were the people we were looking at. There was never an interview. There was never a conversation with these students. We never knew, do they have what it takes to make it through a program? And then what happens is you select these students, you don't know them, and they start this program, and then they realize we can't finish it. So we might start with 50 and we end up with 30.
Yikes.
And that's 20 seats that other people could have taken. So I think we also have to look at the educational system and how can we improve the selection process so that we are graduating more dental hygienists. Because once you lose that seat, most schools start their programs yearly. You can't accept new students again for an entire year. That's an issue.
It is an issue. Yeah. I know. And when I hear or see stuff online that it's like there is no shortage, it's a retention issue because offices are terrible. I'm just like, when you look at the numbers as far as graduating dentists and graduating hygienists and their need, I think I talked to one consultant and she said that the ratio of hygienist to dentist preferably is like 2 to 1 or 3 to 1, because if you think about it, a dentist at an office likely is working with a couple or a few hygienists. And she was like, the numbers just, they're not there. So there is definitely a shortage. And yeah, maybe there's some toxic work environments out there too, but there's definitely not enough of us.
Well, and also, are we elevating the care that we're providing? And I was listening to, when you worked with Dr. Kessler and how high the level of care you provided was for your patients. Now we have these temp agencies paying top dollar, right, for dental hygienists to temp. And now all of a sudden, hygienists are going out and saying, well, I want $60, $70 an hour. And I get it. I know that dental hygienists say, well, that's not our fault. The offices have to participate in insurance plans, but some of them have to in order to get patients in the door. It's not their choice. And I'll throw United Concordia out there because we just dropped them as a plan. They were paying us $46.23 for a prophylaxis.
It's ridiculous.
Well, my hygienist makes a lot more than that. So how do we even manage to make ends meet if hygienists are just scaling, polishing, and dismissing and not recommending adjuncts for their patients that can help hygiene departments grow? So I feel the dental hygienists also have to step it up. Yeah. And ask for what you think you deserve. Absolutely. But also show them why you deserve that and the level of care that you provide.
What advice would you have to someone who wants to practice at a high level and wants to do laser or desiccation or all these extra things, but they're only allowed 30 or 45 minutes per appointment? Like, how can someone elevate their care when they literally aren't given the time?
Yeah, that's a huge problem. And I know a lot of hygienists that are given 30 minutes and they're like, oh, but they get an assistant and they get to switch the rooms off. And I personally would never work in assisted hygiene. I just love being able to provide comprehensive care and getting to really individualize treatment options for patients. So I don't know that I could do that. But for me, I feel the dental hygienists were smart. And we can absolutely put together a presentation because what do these practice owners want to hear? If we invest in this, what is the ROI? What are we going to get out of this? So if we implement salivary testing or we buy you a phase microscope or, our practice is GBT certified. So we have the airflow master unit and that's all we do. If we do this, how is it going to help to improve practice growth? And that's what our owners want to hear. Go ahead and buy me the desiccation therapy so that I can easily scale. And this is what we can charge for it. And it's well worth it. So I think we need to learn to put numbers together and to say, if you do this, this is how I feel the hygiene department can grow by this, and throw numbers at them. Unfortunately, they are business owners or running a practice that has a lot of bills and they want to know how they can manage those bills. So teach them, show them how they can do it, and show them how a 30-minute appointment's not going to let you close out on a $20,000 treatment plan.
Exactly.
For a new patient that walks in the door, there's no way you can do that. And if you do close out on a bit, I don't even care with our hygienist. She has autonomy over her schedule. You know your patients better than I do. So if you feel a patient needs an hour and a half because every time they come in with tenacious tartar that can't be removed easily, you get an hour and a half. I'm not going to make that decision for you, but she's also lucky that I'm managing the practice and I'm an RDH, and many offices don't have that. So it's a little bit different. So I think speaking ROI, speaking the language that business owners understand and how it can help the practice, especially the treatment plan phase of it. Because if they can help close out on treatment, that alone pays their hourly salary times how much, so I think that's huge.
Yeah, I do think dentistry, in my opinion, we're kind of in a bit of a hot mess right now. And there's blame to go around for everyone. And I do think hygienists are to share some of that blame as well. But we really need to start like the days of us just demanding high wages because we have RDH behind our name, I think is gone. And we need to start looking at things differently. And what you said, present something to your practice owner, whether it be, and you and I might have a difference of opinion on assisted hygiene. I do think that it can be done well, but it takes a lot of training and good systems in place. So maybe it's pitching that to your practice owner, maybe going to some kind of production-based pay and justifying the extra time that you're going to need, or tracking the restorative treatment that you diagnose out of your chair. We really have to show our value, and it sucks that we're not valued right now with some people, but we also don't want to be replaced. And who's going to suffer at the end of the day? I mean, we will, but also our patients, and none of us.
And I also feel that once you make that presentation and you say, I can't do everything you want me to do in 30 minutes, how can they?
Yeah.
How can they? In my practice, we do the oral cancer screenings, radiographs. We take salivary samples to show up base microscopes. We do salivary testing when we need to. We do perio charting with the Florida Voice Works. But we do a lot. I can't expect our hygienists. We disclose every patient. We take pictures of disclosing, take pictures after disclosing is removed. I mean, there's a lot that we expect. So I feel that if practices aren't willing to bend and aren't willing to make the changes, then that's when you leave that practice.
Yes. Yeah.
Right? I think that staying in a practice that won't make those changes just sets us up for failure, because then these practice owners know that they have the upper hand, right? People are still going to work under these conditions regardless. They're going to go on Facebook and say they hate us so much, but they're not leaving. Well, guess what? These offices need hygienists to leave, because that's the only way they're going to change. So I think if practices aren't willing to change, I recommend hygienists don't stay in those practices. I really don't, because they're setting the standard really low for us, and then it's harder for us to fight for elevated care.
So at least try, right? At least see if they're open to change or working with you. And if they're not, maybe start looking for something else.
Yeah. And tell me, Steph, how many hygienists really have tried to talk about why they're unhappy? Have they really approached managers?
I know. I would guess not a lot.
I'm going to say not a lot. I'll share just really quick. I was temping in an office, and I really love this doctor. And I go into his hygiene instruments, and half of them are single-ended. And I'm like, how? This is a universal. Like, how am I supposed to work with a single-ended universal? It's supposed to do the whole mouth. And the cavitrons were all bent. And that was the first day that I worked with him. And I went to him and I was like, Cam, I'm like, what is going on? Like, how do you expect me to, do you want me to like just have a wand and like wave it over the patient and hope that treatment happens? I'm like, how do you, and he's like, what are you talking about? What am I talking? Let me show. And I brought the bin to him, and he's like, Lisa, you are the first person. I'm busy with dentistry. He's like, you're the first person who has ever complained about the lack of instruments in the practice. And I'm like, are you kidding me? And he sat me in front of a dental catalog and said, order what you need. And I was temping because he wanted me to temp again.
Wow.
So are we really fighting for what we need, or are we just complaining, leaving at the end of the day, getting frustrated, but never giving our dentist or our management team the chance to make things better? Yes. If they don't hear it, they need to hear it. They're busy. If they don't hear it, they're not going to try to fix it. It's not at the forefront of what they're trying to focus on. So we need to be vocal. We need to open up to them.
I think we assume that the front desk or the assistant or the dentist knows everything, like what you just said about the crappy instruments. We assume that they know about that and they're choosing to not replace them. Mm-hmm. But you're saying he had no idea.
No clue.
It just takes us, like, maybe they don't even know that you're hating having 30 minutes per patient, but you haven't said anything, so they think everything's fine.
Correct. I think it's time to speak up, and professionally too. Like, I don't want a hygienist coming to me and saying, well, I think you need to pay me $10 more an hour, because when I go on LinkedIn or when I go on, all these that's what they're being paid. Well, I don't care. Why do you deserve $10 more an hour? Why do you think you're worth $10 more an hour? Go ahead and present your case. And if your case is a good one, you'll get it. But I don't want to hear I deserve $10 an hour more because that's what everyone else is getting. You need to be able to say what you're going to bring to the table.
And can I tell you something, Lisa? I haven't
Yeah.
really said this publicly, and here I am doing it on a podcast, but I did that. I was not happy at the office that I was at. And I thought that if they just paid me $10 more an hour, that that would fix everything. And I had it in my head that I'm a hygienist. These patients are coming in to see me. My ego was way bigger than it should have been. And so I basically demanded that they pay me more. And they said no, rightly so. I wasn't showing my worth. I wasn't proving why I deserved this. And then a couple of years later, like I moved on from that practice. And a couple of years later, I reached out to them and I was like, dude, I am so sorry. Like I was an asshole about this. And so if anyone is listening and can resonate with that, I have made that mistake too. That's definitely not the way to go about trying to get more money.
Yeah, yeah. And even it worries me sometimes that because when we launch this movement and when we gain more respect and when patients know what to expect in their dental hygiene visits, are dental hygienists ready? Because when they don't do that oral cancer screening to check for oral and pharyngeal cancer and see if there's any abnormalities, the patient's going to say, wait a minute, aren't you supposed to do an oral cancer screening?
Yeah.
When they don't take that blood pressure to see if the blood pressure is high and the patient's at risk for cardiovascular issues, the patient's going to say, aren't you supposed to take my blood pressure? And we have to be ready to answer to that, right? So that's where I said this movement is going to do two things. It's going to elevate the knowledge that patients have, but it's also going to elevate the care that we must and should be providing for patients.
No, I love that. So when we talk about your initiative, we're talking kind of a big picture, right? Like a big goal.
Mm-hmm.
What about someone who's working in the op who wants to change the perception? Like, what are some things that they could do either with their patients or their coworkers to try to elevate the image of a hygienist?
Have a conversation. So I've had conversations with patients. Actually, the other day, a patient that I was seeing, and I spoke to them. I said, can you believe that? Because he mentioned, wow, this is so comprehensive. You know what you do here. This is pretty impressive. And I said, yeah. I said, can you believe nationwide that initiatives are starting to pass that are trying to bring in people that just get trained on the job to do part of what we do, and they were like, no way. How do we know not to do this? I actually had a pharmacist sent me a message and I shared it on our page. And she was like, please tell me as a public what we can do to ensure that we're getting the care that we deserve. So I think just in sharing on our Facebook pages, having conversations with our patients, I asked Matter, one of the things that they could do is maybe create a handout that's easy for hygienists to print out. And then they just put it in the little goodie bag and send it to the patients, right? To read. Here's something, read it. Make sure that you understand why it's important to come and see a degree holding hygienist. And some people are like, dentists aren't going to like that. Well, they're not going to see what's in the bag. Just throw it in there. But I think most dentists who really care, and there are dentists out there that are great. I'm sorry, but we can't put them all down. There are some pretty passionate dentists out there who care about the services that we provide. So yeah, little handouts, conversations with patients, sharing posts once Matter gets things out there that are going to be really good, just sharing them on the Facebook pages. All of that is going to be helpful in them helping to educate.
I wonder too, who knows what's going to happen with this PR campaign? It could turn into something huge, like you never know. But I just wonder if over time, if maybe they could create something that we could download or a pamphlet that we could give to a patient. Yeah, that would be kind of cool.
Yeah, that's part of that's part.
Oh, okay.
It is. It's part of the plan that they're going to do. And they're also going to create 60-second segments for social media posts because they're like, video is huge. They do want to get patient testimonials involved in this. They're like, that really reaches the masses. So they're really planning a lot of great stuff for us. And the reason I say that all these organizations should unite, Stephanie, is because this material belongs to us. Everything that they create belongs to us. And you better believe I'm not stingy when it comes to sharing.
Yeah.
Like if National wants to use anything, ADHA can grab whatever they want. Our state constituents can grab whatever they want. Hygienists can grab whatever they want. This is going to be for everyone to use. And that's what we need to do because that's how we're going to get the message across to a bigger audience.
Well, I just love your spirit of collaboration because, frankly, I'm kind of tired of the attacking that I'm seeing online, whether it's people attacking each other, dentist, hygienist assistant, associations. I'm just like, oh my God, can we just stop and try to work together?
Yeah, it's such an easy concept, right? And, I know that you had Aaron and Lancet on and they said that they really can't be a part of this because their time is limited, but I get that. I was part of national and our state association. It is time consuming, but my message to ADHA is we don't need their time. We need their verbal support. That's all. Yeah. We need their verbal support in saying this is a great movement we need to move forward with. That's all we're asking for. And in the end, they're going to benefit from it because they can take whatever they need from what's created. And they didn't have to spend the money on it because we did it ourselves.
Right. Right. I know we're getting tight or close to time, but I just wanted to share with you. I was talking to my friend, Alyssa Aberly. Do you know?
Oh, I love her. Absolutely.
I know.
She's amazing.
She is. I'm like, I feel like everyone loves her. But anyway, we were having a conversation and she was like, could someone be trained to scale teeth? Yes, probably. Could they be trained to be a hygienist? No. And I was just like, that is such a gem, what she just said, because that's so true. The technical aspect of what we do, we learned it so someone else could learn it, but to be a hygienist who's focused on oral and systemic health and all of the knowledge that we have, you cannot train that on the job.
No, it's comprehensive. You're absolutely right. And it can't just be trained. And the other thing too is with these legislations passing, I know from scheduling my doctors, when exactly are they going to train in office? Because they have very busy schedules.
Can you imagine? They barely have time to come in and do a hygiene check. Like, how are you going to train?
We call them for a hygiene check because we're interrupting them. Yeah. When are they going to teach scale? When are they going to teach? They're not. So it's not going to happen. So you're absolutely right. And Alyssa's absolutely right. You can't teach what a dental hygienist does. It can't be taught.
Well, I'm so
Unless
excited.
You go to a CODA accredited degree institution. Let me make that clear.
Yes, definitely. I am really excited to see how all of this pans out. I think it's amazing what you guys are doing. I'm going to donate today. I've got a couple of podcasts after this, but I'll get on there. Yeah. So where are some places that people can learn more about you or this project?
Yep. So they can go to the Facebook page and they can watch the recording of the kickoff meeting, which was pretty comprehensive.
Yeah. It was.
Tonight, we actually have a 30-minute segment, just a quick segment. So it's not so long, just really discussing the main points about this initiative to make it easier for people to sit and listen to. So they're welcome to join in. That recording is also going to be shared on Facebook. And then if they want to donate, they can go to our website, which is the oralhealthawarenessproject.org. And then they can choose a tier in which they want to donate in. And we gave different tiers so people can do whatever they feel comfortable with.
Okay, awesome. Yeah, I'll put links to all of that in the show notes, the website, the recordings that you mentioned, just so it's really easy for people.
Awesome. Thank you so much, Stephanie, and thanks for having me. And thanks for your passion for this profession. It's awesome to be able to speak to hygienists that are like-minded.
Yeah, I agree. I appreciate your time. And I never thought we would be here. I never thought I would be in this situation as a hygienist, but here we are, and we're figuring it out, hopefully.
Exactly. And we'll do it. We'll do it.
All right. Well, thank you so much, Lisa. And thank you everyone for listening. We will see you next time. Thank you for tuning into this episode of Straight Up with Steph and being interested in living better. What many listeners do is subscribe to the podcast because that allows them to automatically get the latest episodes of the show. Remember, you are the best person to take care of you. And by learning what we talk about on this show, you're taking one more step to being a healthier and happier you. I'll talk to you soon.